My name's Gershwin Kutsi and you're watching Mellow TV. Now, World Tuberculosis Day was observed on the 24th of March, and joining us on Mellow TV is pulmonologist Dr. Bilal Gafoor. Dr. Gafoor, thank you so much for joining us right here on Mellow TV. In the most simplest form, what is TB?
So TB stands for tuberculosis. Tuberculosis is a bacteria, but it's a specific type of bacteria called mycobacteria. It's one of the most common infections of lung in our country. In South Africa, it normally causes a chronic, long-standing cough in patients. It's a fairly destructive disease, particularly if untreated, and often then progresses to chronic lung disease. So it's devastating in this country. So tuberculosis, firstly, the difficult part is firstly making the diagnosis or suspecting the diagnosis, then proving the diagnosis. The treatment is fairly straightforward for the run-of-the-mill tuberculosis, and it consists of treatment, though the treatment keeps on changing, but at the current time, the treatment is a 6-month duration of treatment that is usually managed at a community health center.
Now, Dr. Gafoor, can TB be cured?
Tuberculosis is perfectly treatable, perfectly curable. And I think that point is important in the sense that there's no need for people to have chronic lung disease or destructive lung disease because they have not received treatment or been properly diagnosed.
Now, Dr. Gafoor, there is a misconception that only people with HIV can contract TB. Is this true?
Yeah, so that's a misconception. Right, tuberculosis in this country is ubiquitous. In other words, it is present all over. I mean, you walk outside and you inhale TB. I think you can assume that all South Africans have some degree of tuberculosis, and we all have what's called latent TB. But it's only when TB actually becomes invasive that patients manifest with disease. But immunocompetent, in other words, people who have normal immune systems who are HIV negative, are just as affected as patients who are HIV positive. Given that patients with HIV positivity have a higher risk for extensive or disseminated disease, people who have good immune systems generally can wall off their tuberculosis, but they will still require treatment at diagnosis.
Now, Dr. Gafoor is going to take us inside ICU, where he's going to talk about a case about a patient who was recently admitted.
We alluded to the difficulty and the challenges faced in the diagnosis of tuberculosis at times. Often the diagnosis is missed because of complacency on the part of caregivers, doctors and family. A case in point would be the lady that we're going to visit next. She's been known to have, she's an elderly female, she's been known to have asthma and chronic heart disease for a long period of time, and she's been exacerbating fairly frequently. And often it would mean, as part of the treatment armamentarium of acute asthma, would be to put the patient onto prednisone, which happens regularly. And the patient sort of bounces between admissions recurrently with exacerbations of asthma. And it's only when you do the chest x-ray and collect the sputum in her that you realize that she actually has tuberculosis as the precipitant of her underlying exacerbations of her asthma. It is easy to assume that it's just another attack of asthma or another attack of heart failure, when in fact it's actually tuberculosis. And that just points to the fact that tuberculosis can be quite an elusive disease at times.
Hi, my name is Ena Fortuin and I'm a patient from Dr. Gafoor. And I'm 83 years old. I've been here for a week. All I can say is a very nice doctor. If he says you can't go home, Ena, then you can't go home. And the nurses also, they're fine. I want to thank Dr. Gafoor and the nurses who look after me. They all are amazing. Thank you.
Thank you so much to Dr. Bilal Gafoor, a pulmonologist at Melomed Gatesville, talking about TB and also what to look out for and how you can treat TB. Now, the theme for World TB Day is Yes, We Can End TB, and it's up to you and I. Now, if you need the assistance of a doctor or a specialist, please feel free to visit your nearest Melomed hospital. From all of us, as always, take care of yourself and take care of your loved ones. Until next time, goodbye.